appliances for kids that were removable that we've never seen before.
And for me personally, I thought some of the things would benefit my own daughter. This is Anya. She is 6 years old. We adopted her from Russia. So she was institutionalized in an orphanage until she was 25 months old when we brought her here. From day one, I already knew that she had disruptions in her sleep just because of the setting that is present there. Most of the kids, they don't sleep, they're rocking back and forth. Her soothing mechanism that she resorted to was putting her 2 fingers in her mouth. She didn't go this way, she went this way. So she did have an open bite, yeah, so because she was pushing it out. So she was putting more force, you know, this way. So she came home at 25 months old. We finally got her to stop at 4 years old. She's also going through occupational therapy, speech therapy. She is in special ed at school, mainly for psychological reasons. She was diagnosed with PTSD.
Can you bite down for me? Growl like a unicorn? Very good. Midlines look good, right? So then we just take this upper lip. We're going to look to see if this attachment pulls that tissue from the lingual.
Wait in that chair, AJ.
Come on, AJ, right there. Pop up there, AJ. Good job.
So AJ is 9 years old now. He's diagnosed with ADHD. He has an EOE, eosinophilic esophagitis, so he has a rare immune disorder with allergies, so he's allergic to 12 different foods. We're using this appliance to see if it can help more oxygen, you know, kind of get into his body at night. He wakes up a couple times a night. From the lecture, you know, we learned how things work, which was great in the airway and expanding that airway to help more oxygen come in the body, which can eliminate some of the other issues that may come up. So I'm excited to see it work and put it to work.
So we're just going to make sure. I love making sweet little girls with pink jackets. It's so fun.
So a lot of my families that come in, I've asked them how they heard about me, and they said from other adoptive families. I'm very connected in the adoption community. And because of that, a lot of them exhibit similar things that Anya does, and so they've come to me to ask for help. So I'm excited to see what I can do to help that community.
For me to introduce a product, I usually tell parents this is what I've done on my own child. Mind your back teeth again? So it's very important for me to practice what I preach, and so I think we can get him started now, which will help.
Dr. Lee, maybe.
There we go. And close.
Upper posterior archway. Can you open real big for me? Oh, that's kind of big, huh? Stick your tongue out and sing with me. Say, ah!
Vanessa has been my patient for the last probably 3 or 4 years. She presents with a pretty significant open bite. She has been sucking her thumb mainly at night, right, honey? At night, but today she said that she would like to stop, but she doesn't know how, so we are hoping that this will help her with it.
Are you excited about getting a habit corrector?
For me, it was kind of exciting because the science that they went over in the lecture made sense to me. So it's exciting for me, and that's why I'm excited to get my kids going.
I'm really excited to see where this is going to take us, because this is very personal to me. I had my own habits that have led me to where I am now, and I do have a lot of oral issues because of it, sleep deprivation, things like that. Also for my daughter, who does suffer from PTSD, and honestly I'm speechless. I didn't know that this existed, and when they told us it had been around, I thought this was something brand new. So that was an eye-opener for us. I've always believed in keeping an open mind and trying to